Mental Health Week in what's been a difficult year for many new mums. Chris Barnes is a psychologist with the Gidget Foundation and she joins me now. Chris Barnes, welcome to you. Firstly, what do we mean when we say perinatal anxiety?
Well, I think it's like any other sort of anxiety. It can be symptoms that are physical and it can be symptoms that are psychological as well. So in the perinatal sphere, we talk about perinatal anxiety and depression because they often happen together. So it can be things like, irritability or physical things like heart racing or sweaty palms, that sort of anxiety where you might be a little bit more irritable, your thoughts are racing, that sort of thing. And then it's often coupled with depression, which is, like low mood and lack of joy, different sort of inactivity levels, appetite, sleeping. So in that early parenting period, those two things can happen together and it's very common.
Is it clear whether COVID and coronavirus lockdowns have increased the incidence of perinatal anxiety in Australia in the past 18 months or so?
Yeah, I think we can tell from different services and especially from Gidget Foundation, the demand for our services has increased 127%. And I think that's across the board in all mental health services in Australia. The demand has been huge. And I think most parents, there's research that says about 90% of parents recently have said that anxiety, depression is their most common concern and has been over the last 18 months or so. We know it's had a massive impact. They have had less ability to have parents come and visit them and give them support. Hospital arrangements have changed. And they've been quite isolated, and that lack of community that they've really experienced. It's been really, really hard on new and expectant parents.
Have new mums been offered or suggested alternatives to those all-important mothers groups, particularly after the birth of a first child, the types of mothers groups that might not have been available for many in lockdown?
Yeah, I think a lot of organisations have turned to online support groups like Gidget have done. We've got online sort of Facebook groups. And I know other organisations, there are about more than 40 organisations who have partnered together with us in Perinatal Mental Health Week. And a lot of those organisations have done online courses. Hospitals have done online educational programs, and other like Tresillian and Karatani and other organisations have made, lactation consultants available online and other sort of more parenting skills courses. So there has been a lot more that's gone online. And for some people, that's been enough. And for some people, it hasn't. I think nothing really replaces that face-to-face sort of connection with community and with someone, but it has been a very good alternative. And in fact, at Gidget, where we do a lot of our consultations, well, in fact, all of them up until very recently via telehealth, we know that the clients as well as the clinicians are saying that it's equally as effective as face-to-face. And we hope to sort of continue that offering as well, because that's really nice for new parents to have an online sort of more easily accessible support network.
Exactly. It can be easier at times, but are face-to-face appointments becoming more available now?
I think they are, and I think that's up to the individual organisations, whether you're working in a hospital or your own private practice, and all different organisations will have their own policies about how to keep their staff or their contractors and their clients safe.
And so
we're offering more face-to-face. We're starting to do that gradually, and I think most organisations will as well.
For any new mums or loved ones of new mums watching and who may have just become aware of some of the symptoms you mentioned earlier, where should they go first for help?
Well, I think if you go to the perinatal mental health website, it's PMHWeek.org.au. All of our partners are listed there, and they will have all the different organisations and the ways that they can help. But a first starting point really is probably like your GP, a trusted GP who maybe knows you and can get a referral to appropriate care for whatever support that you need. But it is hard. It's hard to speak up about it, and it's hard maybe for other people to recognise because there is such a stigma around mental health during that time when it's meant to be such a happy, joyful time. We know that 1 in 5 women and 1 in 10 men or partners, and it doesn't have to be biological parents even, suffer with perinatal anxiety and depression in that first year or during pregnancy. So it's very common, it's very treatable, it's just getting started, and having that conversation and recognising that maybe you're not doing as well as you maybe anticipated. Nothing you're doing is really helping, and maybe you need to reach out, or if you can't, hopefully someone around you has noticed that you're not doing as well and then is able to help you get that timely and appropriate support.
Thank you for speaking to ABC News on this incredibly important topic. Chris Barnes, a psychologist with the Gidget Foundation. Great to speak to you.
Thanks, Kirsten. Bye.
Now at the